going to impact the lives of people. And so we have to get it together, and we need to be more proactive and not reactive, particularly in poorer communities. The lack of really healthy food choices is going to have a long-term impact on the financial stability of our entire country.
Thank you, Eric. Chris, we've heard Eric talk about a lot of the things that your organization, Health People, has set out to do. Tell us a little bit about the role of peer education in cases like Eric's, and giving them the tools and the support to manage their own diabetes, and what you're doing with that.
Well, thank you. I'm not sure Eric has a peer, but it's so important. People feel, how shall I say, they've been sick for so long, they feel it's impossible, there's nothing they can do. So when someone from their community comes and starts showing them and telling them what they can do, someone who's lost 100 pounds themselves, someone who's reversed their own diabetes, then it becomes believable, as the borough president said, credible messengers. We through special federal funding, which ended just as this crisis started, we trained a group of peer educators from the Bronx. Nobody had ever done this before. Most of them had diabetes themselves or their family members did. They put 2,000 people on Medicaid in a diabetes self-care course, a 6-session course. That is a record for a community group, but I believe this should be done not only all over the city, but all over the country. And it's really sad to say that both the Trump administration and the Cuomo administration defunded this, just as the COVID epidemic was making it clear how crucial controlling diabetes and other chronic disease was to controlling the COVID epidemic. And again, with nutrition, with plant-based eating, again, someone coming to you from your community, it's not always easy to find the right things in the South Bronx or East New York, but people get together in groups, they brainstorm together, they say this store has that, you can get this there. It's just so important.
Thank you, Chris. Dr. Lustig, for people who have any of these kinds of chronic conditions, as the pandemic maybe is hitting their region, they might say, I've got this condition, I'm overweight, whatever else it might be. I can't really do anything about that. And I'm focused maybe on protecting myself from the pandemic. And they're not making the connection between those two things. In what you're advocating with adopting, a kind of diet that results in lower insulin or insulin sensitivity, how quickly, if someone were to switch to that, could they start experiencing the health benefits that could in fact help them deal with COVID if they had the misfortune of contracting it?
I'm glad you asked. So a lot of people say, the die is cast, I've been eating fast food for the last 50 years. I'm, just as much a fast food addict as the guy in the White House. What am I going to do? By the way, I think that's one of the reasons why the CDC and the NIH have not mentioned food, is the fast food addict in the White House. They don't want to piss him off more. The fact of the matter is, we studied this, not with COVID, but with insulin resistance. We took 43 children from our obesity clinic at the University of California, San Francisco, all Latino and African-American, low socioeconomic status, all high sugar consumers, all fast food junkies, all with metabolic syndrome. And what we did was we studied them on their home diet. And then for the next 9 days, we catered their meals. No added sugar. No added sugar. We took their percent calories as sugar from 28% of calories down to 10% of calories. So we got rid of we took the pastries out, we put the bagels in. We took the chicken teriyaki out, we put the turkey hot dogs in. We took the sweetened yogurt out, we put the baked potato chips in. So we didn't give them good food. We took the sugar out, we put starch in. Now, I'm not going to tell you starch is good, but compared to sugar, it's a walk in the park. And then 9 days later, we studied them again. Every aspect of their metabolic health improved in 9 days flat. Their fasting insulin went down. Their glucose went down. Their blood pressure went down. The amount of fat in their liver went down. And most importantly, their pancreas started making insulin properly. And their insulin sensitivity improved by 25% in 9 days flat. We've done the same thing in adults, and it took 2 weeks. So people who say, oh, I can't do anything about it, or the die is already cast, or, I've been eating this way for the last 50 years, what's going to change? You can change your metabolic health status in 9 days. If you got your insulin down, if you basically ate a real food diet. Now, I'm not necessarily a plant-based diet advocate per se. I think you can do it with animal products also. What you can't do it with is ultra-processed food. If you think Cheetos is food, all is lost. It's just that simple. But if you eat real food, which is what we advocate, you can change your metabolic status in 9 days. Thus, number one, preventing diabetes, reversing your risk for heart disease, getting rid of fatty liver disease, and most importantly now, reducing your risk for dying from COVID. So this is not a fait accompli. You can do this. Anyone can do this, but you have to know what you're doing and you have to know why.
Eric, we've heard Dr. Lustig explain this very clearly, that it doesn't take all that long for it to start having positive effects. Based on your own experience and what we're looking at with what's impacting New York with COVID and the diabetes concerns, what would you like for the public to know about? Really be a cheerleader for us. How can they gain some confidence and some momentum that they can do this and that it will have an impact in just barely a week, according to Dr. Lustig?
Well, and as I stated, we're talking about it was the 3 weeks before my vision returned as well. And what the doctor is saying, I think is crucial to know that there is no age limit to this. The body wants to heal. We just have to get out of its way 3 times a day, breakfast, lunch, and dinner. My mother at 80 years old, 15 years diabetic, 7 years on insulin, when she decided to go, whole food, plant-based, in 2 months, mom was taking off her insulin and 9 of her medications were cut in half, and she was cycling off of those as well. I think we have to recapture our health system. Right now, what we are doing is not sustainable. You can't have 30 million Americans diabetic, 84 million are pre-diabetic, spending 80 cents on the dollar on chronic diseases, and believe that we could continue to have a pipeline of young people who are, actually getting these diseases earlier and earlier. And our systems are in a really conflict with each other. Until we, number one, become honest about this conversation, and everything from our medical schools, our institutions, where we feed people in correctional facilities, in schools, ACS, Child Protective Custodies. Every place we feed people, government should not feed the crisis. We should really be moving our country to a healthy place. And I'm excited because young people are now engaged. They're looking at their menus at school and they're stating that they want to have this great relationship of improving not only their mothers at home, but Mother Earth. Our eating habits they're actually destroying our planet in the process. And so there's a new energy. You have a great deal of doctors, like the program we have at Bellevue Hospital, first of its kind in New York with lifestyle medicine. I think people are moving to a place of wellness, and they're taking control of their eating habits and how they are looking for better food in their communities. So I'm excited about the future. I think we need to have the right leadership on a federal, state, and city level that will move our country to a more healthier place.
Thank you so much, Brooklyn Borough President Eric Adams. I know you have a hard out in a couple minutes. We're going to move on to talk to another of the doctors doing this kind of research and some of the peer educators, but we really, really appreciate you taking the time to be with us and share your story and perspective on all this. Thank you very much.
Thank you.
Dr. Thangadu, tell us a little bit about what the science that you've done says about the benefits of a diet-specific, plant-centered lifestyle that we've been discussing about reducing chronic disease. What are your studies showing about all of that?
Yeah, so I have been on a plant-based journey myself, which started with me about 2 years ago, and saw such profound impact on my life and my family's life that I started digging into the science. And as many of you know, in the past couple of years, there's just been a huge outpouring of science supporting a plant-centered diet. And like Dr. Lustig said before, it doesn't have to be plant perfect, doesn't have to be plants only, but does have to incorporate plants. So I have been delving into that science, but big journals have been publishing on this. JAMA has had multiple articles on it in the past year. Cell had one on ultra processed foods, I think in 2019. And so the science is there supporting plant-centered diets. Even the ADA and ACE diabetes guidelines have plant-based diet in them, a diet that is focused on high quality food, fruits, veggies, whole grains, legumes. And so as I started learning about plant-based diet, I had some very brave patients who I started my own practice around that time that is focused on lifestyle optimization, left the traditional system because I just felt the same things that we've talked about here. We are living in a healthcare system that does not focus on health optimization. It focuses on a fee-for-service model that is sort of a churn and burn through the day, get patients in and out. And I just saw that here in San Antonio, we have a very large diabetes practice, one of the largest in the world, yet patients are still getting worse. And our diabetes epidemic is burgeoning. So I decided to step away and start my own practice where we really focus on lifestyle optimization and starting with a plant-based diet, but also additionally using motivational interviewing, goal setting, exercise, sleep, stress management, all of these things that all of us know are very important, but are ignored in the traditional setting because of misaligned reimbursement and also perhaps physician lack of education and a lack of time. And so what I have seen in my patients, I've been studying a cohort of patients that I serve that is retired San Antonio police officers and firefighters, utilizing, endocrinology expertise. So of course we use medications, but with a real focus on deprescription and optimizing lifestyle, with a focus on plant-centered diet. None of my patients are completely plant-based, probably, or maybe a handful of them are, but we have reduced A1Cs significantly and also improved patient engagement and empowerment. And these are folks who had been struggling with diabetes in a different care setting for decades. Most of my patients have had diabetes for more than 10 years, often more than 20 years. And I have been able to pull these patients off. I had a patient last month who was taking 100 units of insulin a day or more. And within 2 weeks, she was off of insulin completely by changing her diet. And so the anecdotal stories that I have are just profound in both type 1 and type 2 diabetes, even in patients who are quote unquote late stage diabetes. There are some patients who are not going to be able to get off all of their medications, maybe many patients that can't get off of all of their medications, but everybody is on their place in their journey. And there's a lot that we can do to help engage and empower them to reduce their dependence on medications, and more than that, improve their chronic disease risk. Because as we know, diabetes increases risk of most things, most chronic diseases like kidney disease, eye disease, vascular disease, cardiovascular disease, stroke. But here in this acute time, coronavirus is staring us right in the face. And as an endocrinologist, I suspected this early in the crisis, and I actually did a webinar on diabetes and immunity, and early in the pandemic started counseling my patients. I have a small patient panel because of the high touch practice that I have, but I told my patients, look, you guys are going to be highest risk. This is a time, it's going to be hard, but it's a time to buckle down. Check your blood sugars frequently. Make sure you're doing all the things that you're already doing. Don't fall off the wagon. And I'm happy to say that some of my patients who have had COVID have come through. Knock on wood, none of my patients have had to be hospitalized, but I tell them, you know, if this had been you a year ago where your A1C was, we would be talking about a lot of different things than we're talking about now. But so there have been multiple studies that have shown even a 0.8% A1C reduction significantly decreased patients' risk of severe COVID requiring mechanical ventilation and ECMO, and also death, just a small A1C reduction. So it doesn't have to be, you know, if patients are able to transform their lives, turn their worlds upside down overnight, fantastic. You know, blood sugar can come down from 400s to 100s literally overnight. I've seen it happen on continuous blood glucose monitoring. But even if patients cannot completely flip their lifestyle upside down, it's about progress, and everybody can make progress, whether that's one plant-based meal a day or 3, you know. And so I think that you're absolutely right. Everyone has said here, we need to have a public health outreach because this is important stuff and powerful stuff that people need to know, because here in San Antonio, we have a large Hispanic population, and people are told, oh, well, my grandma, my grandpa, my mom, dad, aunts, cousins, sisters, brothers, all have diabetes. I'm just going to get it anyway. And when we really know diabetes, type 2 diabetes is a lifestyle disease. It's 80% lifestyle, 20% genetics, or something close to that. So we really need to empower people that, you know, diet runs in families too. So if we can change that, that is something that is in our power to change, and your lifestyle is in your hands. And even if you have gotten sick with one of these diseases, you still have the power to improve or potentially even reverse it.
Dr. Arti Thangudu, MD, she's a physician and the founder of Complete Medicine, right? That's the name of your practice.
Mm-hmm.
And also she's certified in plant-based nutrition, and she's also a triple board certified physician and works as an endocrinology, diabetes, and thyroid specialist there in San Antonio. Thank you so much for sharing your thoughts, Dr. Thangudu. We'll come back to you for some more shortly. I want to introduce next a couple of peer educators that we have joining us. We have Loretta Fleming. Hi, welcome, Loretta. Thank you so much for joining us. And we also have Elton Santana. Elton, thank you for joining us too. I want to ask Chris briefly. Chris, could you kind of sum up for us what Elton and Loretta do as peer educators? And I want to ask them to share a little bit about their experience working in that role.
Yes, I will. I think Loretta's microphone is muted.
It is, yeah.
What they do is really quite amazing. We started this maybe 4 years ago. We just went out in the community and looked for people who didn't know but wanted to be diabetes peer leaders. And people came forth. They didn't know what it was about, but they knew something had to happen. And this is the total power of trying to put communities in charge of their own health. Since then, they do usually a 6-session course, but we have a 7th session also because this is the Bronx and our amputation rate is so high, unfortunately. So we often do a 7th session on foot care for people with diabetes. They take it everywhere. They take it to churches, to public housing, schools. We did this course in homeless shelters and We had an 87% graduation rate in homeless shelters, and according to evaluation by the New York City Health Department, the participants reduced their emergency room visits by 45% in 6 months. So what they do is take people the information they don't have. It is so terrible not to give people this information, especially the people who need it most. And then they give them real encouragement and support to start thinking about how they're going to use this information. As Dr. Thangadou said, if people can just take 1 step, 2 steps, they've had the experience, someone comes to the first class, they've got their 3-liter bottle of soda, and they say, "You're not taking this away from me." And we say, "We won't." You'll take it away yourself if you want to. But so I think they're much better at explaining what they do and what they see. And I think it's important to remember here, most people in the United States have had their nutrition, I shouldn't say nutrition, their malnutrition education from television since the day they were born. So some things that seem very basic, they haven't really been informed before.
Loretta, could you tell us a little bit about your personal experience in getting your A1C under the danger level using these same kind of nutrition lessons and support plans that you yourself are taking to the community as a peer educator?
Yes, there was a time when I was 378 pounds. My A1Cs were like in the 12s or the 13s. And by me taking the diabetes self-management program, the diabetes prevention program, I went from 378 down to 240. And my A1C had went down to 5.7. So this program does work. As Chris said, we have been all over. We have went to adult day centers. I have done many of classes in adult day centers. And we go and we teach people education. There's a lot of things that people didn't know about diabetes, and they just thought that diabetes was a death sentence. And we taught them that it's not a death sentence, but it's a changing of what you eat. We're not telling you not to eat it, but we're telling you to change your habits and take baby steps. I used to be a person that used to love pasta and bread. I got to a point where by taking these classes now, I'm not a pasta eater anymore. And the bread, I eat ultra thin breads now. I used to go through, a 3-liter of soda, Pepsi, every day. I haven't touched a Pepsi in about 5-6 years now. So this program does work. It does work. And I've had so many people who have taken the class, they come back to me and they tell me, I've lost 15 pounds, I've lost 20 pounds. I stopped drinking soda now, I drink more water. Just little changes that they have made through taking these classes have helped them to maintain their weight and maintain their A1C and their diabetes.
Elton, can you tell us a little bit how your experience as a peer educator has not only helped you impart this knowledge to people in your community, but it's helped you to practice what you preach yourself?
Absolutely. I've been a diabetes self-management peer leader now for a couple of years. And the first few months, in doing workshops and with our senior citizens, mostly senior citizens, I have actually, my A1C has gone down to the point where my doctor took me off of my diabetes medication. And so, as Loretta mentioned, this system definitely works. I'm living proof of it because my A1C has been down. It's at 6.5 rather, and it's been that way now ever since I was taken off the medication. So through teaching people, reaching out to them, it's very important, especially now with the pandemic. And what we're doing now is we're actually calling people on the phone, since I have to work from home now, through a computer system which is called Unitas. And we teach these people what the blood sugar levels are and what to look for, what is too high, what is acceptable, what is too low. We also teach them about the plate method, which, you know, is this chart here, which teaches me and how to explain the plate method and portions, how to read labels, how to look out for, you know, the sodium and the sugar in the products that they buy. We teach them how to deal with emotions, because from what I found calling these people, they are very afraid. They're afraid to go to the doctor, and we try to encourage them and tell them, you know, it's okay. Now, doctors are making sure that if you go to the hospital, that you are going to be safe, that they have measures, and we teach about lower extremity amputation prevention, and we teach them how to take care of their feet. And by practicing what I preach, I have been able to sustain my A1C at 6.5. And in fact, when I speak, you know, when I follow up with these clients, they tell me as well that they have improved. And so, and they're very appreciative and very receptive to this. And as Loretta said, this program does work.
Thank you, Elton. Dr. Lustig, in the goal of reducing or eliminating ultra processed food from the diet and creating a lower insulin diet or getting the body to a state of insulin sensitivity, can you explain a little bit about how that works and what are some of the pathways toward achieving that? That's sort of the underpinning of what a lot of this peer education is based on.
All right, I'm going to give you 1 hour's worth of biochemistry in about 30 seconds. Everybody thinks it's
The
about
timer's on.
Yeah, okay. Everyone thinks it's about obesity. It's not. There are 3 fat depots in the body. 3. One is called subcutaneous, or for lack of a better word, big butt fat. Cosmetically undesirable, but metabolically inert. Doesn't matter. But that's what you measure when you stand on the scale. Second one is visceral obesity, or big belly fat. Now that one's important, and that one causes metabolic derangement. And that one, it turns out, is most responsive to stress. Not diet, but stress. So the more stressed you are, the bigger your belly. And we know that because people who have endogenous depression, who are actually losing weight, still end up with increased visceral fat and metabolic disturbance on that basis, because the visceral fat sends messages to the liver directly through what we call the portal system. The third fat depot is the most important for this discussion, and it's the liver fat. And the liver fat only has to be a total of 300 grams, that is less than a pound, in order to wreak metabolic havoc on the rest of the body. So anything that drives the liver fat, you don't see it on the scale, but that's what's causing the biggest change in your metabolic status. And that's what's fomenting all of the chronic metabolic diseases that we know about today. Type 2 diabetes, hypertension, lipid problems, cardiovascular disease, cancer, dementia, fatty liver disease, polycystic ovarian disease, you name it. Those are the diseases that basically are due to liver fat. And what we've learned is that liver fat is not coming from the fat in your diet. That liver fat is coming from carbohydrate, and very specifically sugar. Well, sugar is the marker for ultra-processed food, because 74% of the items in the American grocery store have been spiked with added sugar for their purposes, not for yours, because they know when they add it, you buy more. So what we find ourselves in is a vicious cycle of consumption and metabolic disease and continued consumption. And they're making out like bandits, and we're getting sick. Not only are we getting sick, we're getting fat and stupid at the same time. And the fact of the matter is, if you stop the liver fat production, if you get rid of the sugar, if you get rid of the refined carbohydrate as well, because that's also driving insulin up, you can turn this around. You can reduce your liver fat, as we did in these kids, in 9 days, and you can basically reverse this entire process. You can get rid of your diabetes.
Thank you, Dr. Lustig. Dr. Thangadoo, I wonder if you can make the connection to some of what Dr. Lustig described and to research on the impact it has on the immune system. So diabetes, hyperglycemia, other metabolic dysregulation, or Dr. Lustig, you used another term for you said, I forget what you said. You didn't say dysregulated. You said it was distorted or something. I forget what the word was you said.
Right.
In any case, Dr. Thangadoo, what's the impact on the immune system when your body's in that state?
Yeah, so first I just want to add to what Dr. Lustig said. So I have a lot of patients who come in who are perfectly comfortable eating a low carb, ultra processed bar for breakfast, but they're terrified of bananas. Okay, so we have this entire healthcare community and community in general that is just so misinformed about what is truly healthy, that we truly have our work cut out for us, because there's so much marketing. You know, the health food section of the grocery store essentially is oftentimes selling glorified, ultra processed junk food. And so we've got to change the narrative to go back to the produce, I talk to my patients about what a processed food means. Like with an apple, I can kind of figure out, okay, the farmer grew it, picked it, cleaned it, just delivered it. I picked it up, ate it. Okay. Apple Jacks. How did that get from the farm to my plate? I don't know either. So, so that's ultra processed. And so we really have to encourage people to understand what an ultra processed food even means, because I think they're so much a part of our community now that people just don't know what's healthy and what's unhealthy anymore. And I love that you talked about the liver, because insulin resistance at the liver is a huge part of what is causing diabetes. You know, hepatic gluconeogenesis, or the liver constantly producing sugar and not listening to insulin signaling, is a huge part of insulin resistance that we need to cut down with things like diet, exercise, avoiding these ultra processed foods, stress management, sleep, all these lifestyle things that are important. Specifically with immunity and diabetes, I like to think of it in 3 parts. 1 is inflammation, 2 is immune cell function, and 3 is vasculopathy. So basically, diabetes is a state of inflammation. So when you have an infection and you have diabetes, you've got a double whammy of inflammation that is more likely to get into a vicious cycle and go out of control. Also, diabetes affects immune function. So there are certain cells in the body like neutrophils, macrophages, a complement cascade. All of these cells are involved in healing, fixing an illness, but in diabetes, their function is impaired. Diabetes specifically with hyperglycemia, okay? Now, diabetes, even though we don't feel it, it wreaks havoc on our vessels, our blood vessels. So the third part of how diabetes impairs immunity is through vascular dysfunction. So poor vascular flow, the vascular walls get thickened, impaired blood flow impairs your body's ability to get immune cells to the areas of the body that need healing, and also impair getting oxygen to those places too. And so you need those things to heal. So with this triple whammy of inflammation, immune dysfunction, and vasculopathy, diabetes is just a feeding ground for infections. The problem with diabetes and infections is when you are infected, blood sugars go higher. And so it gets into this vicious cycle of infection and high sugar worsening the infection. So we really need to target it before it gets to that point. And now with COVID, a mainstay of treatment is steroids. So people with diabetes on steroids, or even sometimes the general public who doesn't have diabetes, steroids increase blood sugar too. So while steroids do improve COVID outcomes, if you have issues with your blood sugar and then you're getting high dose steroids with COVID, now you're in a situation where we really need to manage that blood sugar aggressively. Otherwise, we may be counteractive to the use of the medication, what it's being used for.
Thank you, Dr. Thangadoo. To Loretta, I'd like to ask, we've heard just kind of what some of the science is backing up the reasons why this is so important. Loretta, what have you seen as some of the challenges that your clients have experienced, and what kind of strategies have you recommended to help them overcome some of those hurdles? And your audio is not live, Loretta. Go ahead and unmute. Go ahead.
Okay. One of the somewhat problems that a lot of my clients had is getting off of the breads. As I said earlier, I was a bread eater. I loved my hero sandwiches. I was a pasta eater. I was a spaghetti eater. I was a rice eater. And it was very difficult at first for me to wean myself off of it. But I explained to them, if you want to eat rice, maybe try brown rice instead of the white rice. If you want to continue to eat bread, instead of eating the big slices of bread, try the ultra thin bread. The ultra thin bread only has 40 calories per slice. So if you're eating 2 slices, that's only 80 calories. Try to cut down on the amount of carbohydrates, your breads, your pastas. And like I said, if you want to eat rice, try brown rice. A lot of people don't like brown rice. They said it doesn't taste right. I said, well, if you want the brown rice, maybe use low sodium bouillon cubes in your rice to season it up to give it that flavor. Maybe that can help you.
And Loretta, what about exercise and how somebody who maybe hasn't made exercise a part of their lifestyle to get the body moving more? They say that sitting is harmful for us. What do you recommend, and what do you talk about with your clients about getting some more movement day to day?
Well, I have had 4 surgeries on my lower back, my lumbar spine. So there was a time where it was very, very difficult for me to exercise. But what I explained to them is that when you're doing household chores, that's a form of exercise. If you're making up your bed, if you're sweeping, if you're mopping, that's a form of exercise. If you're moving, if you're dancing around your house, that's a form of exercise. So as long as your body is getting in some type of movement every day, whether it be dancing or cleaning or washing clothes or whatever. That is a form of exercise. So I let them know it doesn't have to be, running and jumping, somewhat. It could be just moving around in your house, doing household chores, cleaning. That is a form of exercise.
Thank you, Loretta. Elton, as Loretta's describing some of these things that are small steps building toward a better lifestyle, how do you create an action plan and share that with your clients to help them to recognize these achievements and take the right steps in that direction?
Well, first of all, I listen to them because oftentimes they actually explain things about their lives and, how they go about eating and exercising, doing chores and so forth. Walking, I let them know that walking is very important. Now, the action plan would be something that that person can achieve in 1 week. So weekly, they can make an action plan, and they can they can customize it to their lifestyle. They can, maybe they can walk 30 more minutes than they usually do, or they can eat a little bit less of the white rice. They can eat a little bit more of the vegetables that are good for them. So an action plan is something that is achievable to that person, and that is customized to that person. And that's what we teach them.
Thank you, Elton. Dr. Thangadu, how important are sleep and exercise? And I know it's a loaded question because the answer is very. Tell us why they're important.
Yes. So I want to piggyback onto what Elton said, in that action plans are hugely important. We call them SMART goals in lifestyle medicine, but basically giving patients a specific measurable plan instead of telling them to take over the world overnight helps them do the work to get to the goal. So if a patient comes in and says, I want to lose 20 pounds, I say, whoa, that's not a goal, that's a wish, because we don't have a plan. So a goal without a plan is simply a wish. So, and I try to engage patients to say, the work is what's important. If you do the work, you will get the goal. But if you focus on the goal instead of the work, you will not achieve that goal. You'll just be thinking about it. And so I think that's really important. Sleep and exercise, you said sleep and exercise, right? Mm-hmm. So sleep is very important. One, if you are getting poor sleep or you have an untreated sleep disorder like obstructive sleep apnea, which a lot of our overweight and obese patients, even normal BMI patients, I had sleep apnea after I delivered my son and I was normal BMI. So if you are not getting good restful sleep at night, your risk of metabolic disease goes up. If your sleep is not good, you also are at higher risk of making poor choices with regard to diet, exercise, food, relationships. Your ability to manage stress goes down significantly. So if a patient is getting very poor sleep and they have a goal that is related to diet and exercise, I tell them, look, I like your diet goal, I like your exercise goal, but let's set you up for success by fixing the sleep first. Because if we don't fix the sleep, it is highly unlikely that we're going to be able to fix anything else. And there are patients that I have treated for a slew of disorders, whether it be diabetes or depression or PMDD or something like that, that we get them sleeping better and voila, their problems are fixed. It's very, very, very important. I've learned this in my own personal life. I learned it from my children. Actually, I have a 4 and 2-year-old. I watched how bad they did when they didn't sleep well and how great they did when they do sleep well. And I thought, wow, that must be happening to adults. We just have a better filter. So So I think getting great sleep is very, very important. And then exercise too is very, very important. One, for mood. I had a psychiatrist once tell me exercise is the most underutilized antidepressant, which I think is very true. Exercise releases endorphins. I know I'm a better doctor, mom, and wife when I've exercised. And mood plays a big part in all chronic diseases. But also with insulin resistance specifically, we have seen that patients with diabetes improve their blood sugars immediately after they exercise. In fact, there was a study that showed 45-minute bout of exercise on the elliptical improved insulin sensitivity in insulin resistant adults. One bout immediately. So of course that insulin resistance comes back if you never exercise again, but it's very impressive how quickly exercise works on insulin resistance. And I have patients too who wear continuous blood glucose monitoring systems, and they say, wow, doctor, the days I exercise, my blood sugars are way better. I've seen patients, type 1 diabetic patients, who actually have to lower their insulin doses when they exercise. So exercise has a profound impact on insulin sensitivity.
Thank you, Dr. Thangadoo. Dr. Lustig, let's take it now to the mental health question. Metabolic health, sleep, and exercise all sound like they have a very important impact. What's the science behind that, and what do you think is a good takeaway for how we can support mental health so that we can be prepared to deal with all these things through making sure we have good metabolic health?
So we have two other pandemics. We have a pandemic of addiction, and we have a pandemic of depression. Addiction and depression, and they are also metabolic diseases. People think that these are somehow unrelated. These are different. They are not. There are three things in food that matter. Three. One is tryptophan. Tryptophan is the rarest amino acid. It is also the precursor of serotonin. And serotonin is the antidepressant neurotransmitter. That's why we give SSRIs to patients with depression, is to try to up their serotonin. Well, you can't up your serotonin if you don't have enough tryptophan to make the serotonin out of. Well, because tryptophan is the rarest amino acid, it's actually hard to come by, and processed food is very, very low in it, number one. Number two, omega-3 fatty acids. So omega-3 fatty acids are found in salmon, flax, marine life, marine oils in general. But that doesn't make a very good ultra-processed food because, that has a fishy flavor. It is very specifically divorced from processed food in general. Omega-3 fatty acids are essential in terms of improving neurotransmission in the CNS, and omega-3s alone have been shown to cure depression. But we're not eating them. Number three, too much sugar. And sugar, because of its effects on insulin resistance, alter mitochondrial function in the brain, leading to both addiction and depression by activating the reward system, fomenting addiction, and also through the phenomenon of insulin resistance, actually leading to dementia as well. So these are the three primary factors in food that make a difference in terms of mental health. They also happen to make a big difference in terms of metabolic health, because in fact, metabolic health and mental health are the same thing. So fixing it with real food fixes those three, fixes the insulin resistance, fixes the liver fat, basically fixes you. The way I try to tell people, the way I try to explain it to people, very simply, if a food has a label on it, it's a warning label. Because real food doesn't have a label. Real food doesn't need a label. Are there any labels on radishes? Are there any labels on broccoli? Or is there any a label on a plum or a peach? Is there any label on meat? No. The reason is because those are real foods. Any food that's been processed, however, requires a label. So everybody should look at any food with a label askance. And if we actually shopped around the edges of the grocery store and ate the labelless food, we would be doing much better.
Thank you, Dr. Lustig. Chris, I'm going to ask you to bring it home and tie it all together. Food, sleep, and exercise are all medicine, and we need to be prepared better with all these kinds of lifestyle habits so that we can deal with chronic and acute disease better. What do you think is the important take home for all of this, and what kind of resources from local and our national government need to be thrown into educating people about all these things?
I just want to thank Newswise and the panel before I bring it all together. I'm glad this has been recorded. I think everyone can refer people to today's webinar to really understand both how simple this is and complex at the same time. And again, we have to insist that our health departments and medical establishment, I know I go many places where people wish they had a mute button, but we just have to insist we can't watch this anymore. And beyond that, to me, it's always giving the community the resources, training educators from the community, and having them go out where they know how to reach people, and the people they reach will believe them.
Well said, Chris. Thank you so much. With that, we'll go ahead and draw things to a close. Anybody on the call from the media, you're welcome to use quotes or video from today. We're going to share with you the recording and the transcript if you're on the list of people who registered. If you didn't register, email us at info@newswise.com and we'll get you that information. With that, I'll say thank you to Chris Norwood and Health People, Dr. Robert Lustig, Dr. R.D. Thangadoo, peer educators Elton Santana and Loretta Fleming, and we also had Brooklyn Borough President Eric Adams. Thank you all very, very much. Stay safe, stay healthy, and good luck.
Thank you.
Thank you.
Thank you.